Hospitals today are buckling under an impossible weight. Between mounting administrative bottlenecks and extreme clinician burnout, the healthcare system is pushed to its breaking point. Doctors and nurses are buried under outdated workflows and administrative burdens. Every hour spent fighting clunky software is an hour stolen from patient care, creating a backlog that stalls critical medical decisions. The proposed solution often involves suddenly dropping high-end automated artificial intelligence into this overwhelmed clinical environment, hoping to create a smart hospital overnight. On paper, the technology is flawless. It promises predictive analytics to spot patient risks, digital twins to model hospital flow, and automated daily workflows that theoretically erase friction. But deploying this powerful technology into a fractured system without preparing staff sets a dangerous trap. It assumes that software can fix human processes it wasn't designed to manage. The result is a multi-million-dollar paradox. The AI is installed, yet operational efficiency drops, and conditions on the hospital floor actually worsen. On the floor, the human reaction is immediate. Doctors distrust the mysterious algorithmic outputs, while nurses find their daily routines disrupted by a system that doesn't account for how they actually work. We have to recognize why this happens. Healthcare AI fails, but not because of poorly written algorithms or bad data. These systems fail because leadership ignores the human side of the transition. The technology is ready, but the people who must wield it are left behind. Successful adoption requires a specific operating system for human behavior called change management. This framework provides the mandatory structure for human beings to adapt to technological shifts. This adoption follows 5 sequence stages: awareness, desire, knowledge, ability, and reinforcement. Everything starts with the base layers, awareness and desire. Executives must actively map out stakeholder perspectives. Fostering open dialogue between IT and medical staff builds the emotional intelligence needed to establish trust. Grounding expectations is vital. Leadership must clearly explain exactly what the AI does, and just as importantly, what it cannot do. Without securing that baseline of awareness and desire, spending millions to train staff on how to use the software is a complete waste of resources. When we reach the knowledge and ability stages, training must move out of the conference room. It has to happen where the work happens, right on the hospital floor. This is where the super user becomes essential. These are clinicians identified early in the process, who act as translators between technical functions and the realities of patient care. The process concludes with reinforcement. Leadership must continuously address emerging concerns about AI outputs to ensure the tool remains ethically aligned with the hospital's mission. Organizations must realize that this human learning curve requires significantly more time and resources than the actual software installation. These active, continuous management steps are what transform AI from a disruptive threat into a reliable, integrated teammate. When a hospital manages change correctly, the technology becomes supportive rather than intrusive. The smart hospital finally begins to function as intended. Doctors regain time for their patients. Because they trust the predictive tools, they can use the AI's insights to make faster, more informed clinical decisions. Nurses are freed from documentation bottlenecks. The new workflows are seamlessly understood and adopted, allowing them to focus on the ward instead of the screen. For the patients, the care is safer and more personalized. The friction between human and machine is gone, allowing the medical team to operate at their highest potential. This thriving healthcare ecosystem is only possible when leadership bridges the trust gap for every single group in the building. Artificial intelligence, no matter how advanced, is just an inert tool. Its value is entirely dependent on the people who operate it. To ensure AI aligns with ethical care, we must actively manage the human beings who wield it. If we want AI to deliver real value, we have to stop designing solely for technical performance. We have to start designing for human adoption.